In this tutorial, we will review the Endodontics form. We'll show how to record measurements for a specific tooth and see how we can generate an endodontics report and how to store it for future use. Dental work in endodontics is handled through the Endodontics form, which is invoked by clicking on the Endodontics button. The Endodontics form is one of the user customizable forms that we have described in tutorial number 10. The Endodontics form has one additional feature compared to other user customizable forms. The user can add measurements that relate to an endodontics treatment. Click on the Endodontics button. In the middle of the Endodontics form, we see the measurements column. If the measurements box is selected, then the tooth selection box is selected as well. When we first enter the Endodontics form, we can see that dental work root canal treatment is pre-selected for the user's convenience. Let's add endodontic measurements for tooth 36. Exit the Endodontics form with the root canal treatment selected. Visual Dentist is asking the user to select a tooth. Click on tooth 36. The measurements form appears. We will fill in some measurements for tooth 36. We note the presence of text boxes with a yellow border where the user can define his own options. For enlargement system, double click, you can have system 1. System 2. Space for post. Material. Material 1. Material 2. And notes. The dentist will at some point create a report for the endodontic treatment. Click on the button Report Preparation for a specific tooth, which in this case is tooth 36. The report preparation form appears. This is divided in several regions. The top region is the measurements. The middle one is the x-rays, initial and final. The bottom one contains any comments that the dentist would like to include. And below we have some buttons which are pretty much self-explanatory. In the top region, the user has the ability to change prior to printing, saving, or sending the report. Can change the measurements. For example, I put 15 here. It is useful to note that in the original measurements this is not reflected. This is just for the report. Also here in the initial x-ray we can click in the border, go to VD downloads and pick on the initial x-ray. You can have a date of, say, about 1 month ago. The final X-ray, again, we pick from video downloads the X-ray. Let's pick today's date. The report date we can pick as well. And in the notes, the dentist can write whatever he wants, or whatever he wants appear in the report. And once this is set, we click on Print Preview, and you can see the usual setup with the dentist details on top, the patient details, and the report. This report can also be emailed and also saved and attached to this patient. If we click on Save, it prompts us to enter a name for it. And this will be copied in the path name where all external files are copied. If we now exit and go to Files, we'll find the report here. If I double click on the endodontic treatment, you can see that the report is saved. This report can now be deleted if you want, or emailed. But it is saved externally, as all files are saved, and it is attached to patient Tim flag. If tooth 36 requires additional treatment, then we click on Endodontics. The root canal treatment is pre-selected. We exit. We click on tooth 36 again. We see the existing measurements, and we click on New Treatment. We enter the new measurements, and proceed with preparing the report. Now, if at some point in time we need to view the entire treatment, we click on 236 and click on Root Canal Complete History, and it tells us the complete history. Going back to current status will take us here. Button Report Preparation for All Teeth will generate a report showing all measurements for all teeth that have root canal treatment work.